Many people have experienced knee pain at one time or another. Problems come from everyday wear and tear, overuse, or injury. So when can you treat it at home, and when should you go to the hospital? Dr. Charles Stewart of Boca Raton Regional Hospital is here to answer that question and more. Hello, thank you so much for joining us.
Good morning, Marcia.
So first explain, what are the different types of knee pain?
Well, first of all, there are four major types of knee pain. We'll start with the most common. The most common is called patellofemoral disease. That means pain underneath your kneecap. That typically comes with squatting, kneeling, going up and down steps. Very common problem. It happens in 10-year-olds, it happens in 60-year-olds. It's not an arthritic problem particularly, but it can be quite disabling. Often due to the kneecap not tracking well, often due to overuse. Volleyball players get it, people who kneel down a lot, bricklayers, carpet installers. It's a very common problem and can be treated with relatively easily with medications and or exercise program.
Okay.
That's the most common.
All right.
The second most common is what we call mechanical problems. Mechanical problems come from torn menisci, or the cartilages in the knee. Menisci are the little shock absorbers in the knee, and they can be torn. You don't have to have an injury for them to be torn, and that pain is typically when you twist, you get a sudden sharp stab, then it goes away. Sometimes the knee even locks, meaning it will not straighten out. That is due to the torn meniscus. If that is a minor problem, you can deal with that. If it happens once a month, that's okay. But if it starts happening regularly, or it interferes with your routine, whether you're an exerciser, a runner, or a tennis player, then you should seek attention for that.
Okay.
The third type of arthritis, or knee pain I should say, is inflammatory. By inflammatory we mean the lining of the joint, called the synovium, is affected by gout, by pseudogout, by rheumatoid arthritis, different diseases that will affect the lining of the joint, producing pain and swelling. That type of pain is typically pain that's there all the time. Whether you're on it or off of it, your knee swells, it becomes hot and tender, and that needs attention. And the fourth type of pain is the typical osteoarthritic pain. Osteoarthritis is a wearing away of the joint surfaces, and when that wears away, your knee becomes progressively painful, particularly as the day wears on. It's that dull, aching pain that doesn't go away. Worse at the end of the day. Typically, it may swell, it may not. Often gets better with Tylenol or Advil. But that osteoarthritic pain is the one that usually progresses and needs treatment when it interferes with your lifestyle.
And a patient wouldn't necessarily know which type of knee pain they're experiencing, so is there an overall rule of when you should seek medical attention?
When your lifestyle is compromised. And what I mean by that is, if you can't play tennis and you want to play tennis, you should come in. Typically, many of our problems will resolve on their own. The body is a wonderful machine and often heals itself. So if you have pain, use some ice. If you can take Advil, take that safely. And look at what you're doing. What is it that may have aggravated this? What were you doing that may have started this? In other words, if you just laid carpet in your house all weekend, that may have been the cause, and it'll go away in a couple days.
Okay, thank you so much.
Thank you.
Boca Raton Regional Hospital sponsors our expert and underwrites our Ask the Doctor feature.